Hi, we're here today with Dr. Chris Ketcham. He is the Medical Director of Rehab Services at Memorial Hospital. Dr. Ketcham, thanks a lot for joining us today.
You're very welcome. Thank you for having me.
So your patients basically lost out on 3 months, several weeks at least, of therapy services during COVID. They lost out on the routine, they lost out on the therapy, and they were really having to take care of themselves at home during that time or do telehealth. Now we're back open for business. Tell us a little bit about what you were seeing from patients as they come back in. How did they muster through those several weeks, and what's the situation today with them?
Sure, absolutely. It's amazing how much you lose over just a few weeks' time of being inactive at home. It's amazing how quickly that threshold drops even farther, and everyday tasks become so much more difficult, such as just getting out to the mailbox. For a lot of people, the activity of going to a physician's office, to a doctor's appointment, really is therapeutic for them. Not only just the activity of getting there, but also getting out of the house, getting fresh air, interacting with other people. For example, a stroke patient, they are very low with regards to their therapeutic tolerance because of the stroke. And now you subtract 3 months of time being involved with therapy, being involved with the community, and they can set back pretty significantly. So we do have a lot of ground to make up for, but unfortunately, it's not just going to be starting back where they were 3 months ago. And now we have to start back even further than that. And fortunately, we have a lot of resources here within Beacon to kind of help, not only here in South Bend, but also our outreach facilities as well, to help get them back on track. Unfortunately, it just might take a little extra time, but hopefully we can get them there as quickly as possible.
That's important. I mean, as you think about it, there's really no fast tracking therapy. When you've had an injury or sustained something like a stroke, you can't just magically make up those several weeks that you would have been seeing a doctor through.
Absolutely. And there's always the risk of kind of taking extra steps back and undoing some of the work maybe the surgeon did, or having some of those potential deficits from, for example, a stroke with muscle contracture that is so vital to working with therapy to work through all of those potential complications.
So moving forward, obviously none of us have a crystal ball, but we can say that, COVID's not gone yet. We're not out of the woods. So what services does Beacon offer that provides continuity of care for patients, especially in the rehab setting?
Yeah, this is a great point. So from the time you walk into a Beacon facility, take the ER, for example, the therapist and the physicians are starting to evaluate the patient and look forward to what type of therapeutic, let alone other surgical medical interventions may be necessary. And at Beacon, not only at Memorial Hospital, but also at Elkhart, we have what's called inpatient rehabilitation. So after the patient is fairly stable from the medical standpoint on the floor, they can transition right to one of those inpatient rehab units, pending some qualifications are met. And they can continue intensive therapies in the hospital setting with their other physicians just right outside the unit, basically, whether that's floors above or below, to allow regular access to those medical conditions that they're experiencing. And then hopefully from there be able to discharge home, where they would receive then outpatient therapy visits or even telehealth visits to help keep them safe and at home within their family or into the doctor's office as necessary, and then continue to progress with their therapeutic activity in the outpatient therapy setting, all under the Beacon name. Therefore, files are easily transferred. There's not loss of a lot of communication between providers, so we can stay upmost on progressing that patient through care and ultimately to recovery.
And as we're talking about that outpatient setting then too, talk about how we are keeping patients safe. I mean, again, we're open for business, telling folks come back in for outpatient therapy. Yeah. What are we doing to keep them safe?
Well, I think ultimately it's a discussion that the patient needs to have with their referring provider. So whether that be the family practice doc that sent them to therapy, the surgeon that sent them to therapy, they need to make sure that actual outpatient therapy services is the best for the patient, because we do offer teletherapy visits as well. So those patients with significant comorbidities that may have a low threshold with regards to uh, coronavirus symptoms, maybe those patients would be best off treated via the teletherapy route. But for those patients that it is appropriate to come into the outpatient therapy setting, be rest assured that we're taking every precaution necessary, performing the social distancing within the therapeutic gym, cleansing all the equipment between each individual participant, wearing masks, and just performing good hand hygiene, and of course screening all participants before they enter the therapeutic activity to hopefully decrease the risk as very much as possible, not only to patient exposure but also to staff exposure as well.
Safety is a top priority here, that's for sure.
Absolutely.
Dr. Ketcham, thank you so much for joining us. Appreciate all your perspective today.
You're very welcome, and again, thank you for the opportunity.